We've all been deeply shocked and saddened by the death of Prashant Srikumar, a 44-year-old Indian male who sadly died in a Edmonton hospital waiting room with what appears like a heart attack after having waited for 8 hours in the emergency room. I do hope that the family gets justice. I do hope that the hospital and administrative services learn from this experience and make positive, constructive changes to how cases are triaged and patients with severe pain are managed. But today I'd like to take a slightly different angle on this from my own perspective, being a primary care physician, being a family doctor, being a person who deals with prevention rather than acute care. I have worked in emergency rooms for over 1.5 years and managed acute myocardial infarctions, strokes, hemorrhages, etc. But in my current role as a primary care physician, my role is primarily to prevent. And so I'd like to just bring your attention to that side of the story. Heart disease typically takes decades to develop. It takes 10 to 20 years to develop. And the signs are present often beforehand if you look for them in an annual physical type checkup. When we check a person's blood pressure, their cholesterol levels, sugar levels, inflammation levels, and where indicated, even check their genetic familial cholesterol levels like LP-little-a, lipoprotein-little-a. Take their family history, find out if they smoke or not, how active or sedentary they are. We can get an idea as to risk factors. Obstructive sleep apnea, a condition where clients snore and stop breathing, is a common risk factor that can easily get overlooked. 1/3 of all people have an acute coronary event die in the first instance. And in the last year, I've had 3 of my clients, all of them of South Asian origin, have acute coronary events. One of them had a triple bypass, 2 of them had stents put in, but those are the fortunate lucky ones who survived. There are so many who don't. So 2/3 of people with an acute coronary event will be the fortunate ones who survive and have an opportunity to change their lifestyle, to take medication to reduce cholesterol, blood pressure, treat sleep apnea, etc., lose weight if that's relevant, while there will be a subset of the population who never get that opportunity. And the best thing you can do is get your physical checks done. One complaint I have with my clients is often they try to tag on checks with some other complaint. They'll come in with knee pain and they'll mention, oh, by the way, doctor, I think I'm due for my blood test. Or they come with their back pain and, oh, I think, doctor, I might need my mammogram. Well, that's fine. But if you use the analogy of taking your car for servicing, you don't take your car with a squeaky door and then ask them to just check your brake pad. Because the service isn't just a brake pad, it's also the oil change and the filter check and the balancing and so many other things. Similarly, great, I'm glad you asked about your blood test, but did we go through your vaccination history and status? Did we go through cancer screening? Did we make sure we got all the relevant blood tests done? Are you interested in certain tests which are not covered by OHIP, like for example, prostate screening? We need a proper consultation where you do not come with a problem, where the intention is to go through your family history, medical history, smoking history, weight, activity levels, vaccination status, cancer screening status, metabolic and cardiometabolic health screening status. Go through all of that and try to come up with a plan to optimize your health. That is extremely important. I like to use a car analogy here as well. 20, 30 years ago, you'd see a lot of cars by the roadside broken down. These days you don't, because most people go in for their annual service or their 6-monthly service, and they get things fixed before they break down. And it needs to be the same with the human body as well. In our clinic, we recommend this is done in your birthday month. So it's not up to me to remind you, it's not up to anyone else to remind you. When it's your birthday month, that is when you can send us an email and say, can I have an appointment, virtual or otherwise, to go through my overall health check? And we'll be happy to help you out. And if you're not a client at my clinic, please reach out to a family physician and arrange your annual checkup. Again, my deep condolences to Mr. Sri Kumar's family, I hope they get justice. I hope the hospital learns and makes changes. But from my perspective as a primary care physician who prevents, I would like people to get their checkups done and get ahead of any problems that might be coming down the road.